Well, breaking news tonight concerning COVID-19 in West Virginia. Governor Jim Justice has just requested and received the resignation of State Public Health Officer Dr. Kathy Slemp. A press release issued a short time ago said the governor cited, quote, his lack of confidence in Slemp's leadership. Also tonight, there are increased worries about the impact of tourism in the Mountain State. There are big concerns about both travel to and from West Virginia over the July 4th holiday weekend. At his daily COVID-19 briefing, Governor Jim Justice urged people from the Mountain State to stay close to home for the holiday and especially to avoid going to crowded beaches such as Myrtle Beach, which have become breeding grounds for coronavirus.
There are 19 outbreaks in 11 counties that are tied to people traveling to Myrtle Beach. You know, I strongly would tell you that if you're thinking of going to Myrtle Beach, rethink what you're doing and everything. And the other thing is, if you have been, go get tested.
Of course, there are similar concerns caused by a large number of out-of-state tourists coming into West Virginia for July 4th. The governor's team says if you do encounter travelers in a place with lots of out-of-state plates, you and they should keep a distance and take precautions.
Again, when people come in from out of state, it's a similar situation. In fact, more so. Wear a mask if you're around visitors who come in. Those individuals may not have symptoms and may have the virus.
Workforce West Virginia announced that the unemployment rate in all 55 West Virginia counties dropped in the month of May, perhaps another sign that things are starting to rebound. In another development today, the number of church-related COVID-19 cases in the state is going down, but it is still a big concern. And also today, Governor Justice announced that foster parents in West Virginia would receive an additional monthly payment per foster child before the end of this month. That is to help them make ends meet during the pandemic.